I would like to introduce the Department Secretary, Dr. Jeffrey Beer.
Well, good morning, and thank you all for coming. I want to extend my appreciation to everyone who worked so hard to bring this project to completion and make today possible. 17 years ago, a federal judge ruled that California Department of Corrections and Rehabilitation was not adequately caring for inmates with serious mental illness. Since that time, CDCR has been under a court-appointed special master who has overseen the unprecedented reform in CDCR's mental health programs. The state has now spent billions of dollars improving health care services, staffing, and facilities, and paid the special master and his team of monitors and experts nearly $48 million over the last 17 years. I'm here to echo Governor Brown's and say that the federal courts should now end the costly oversight of our prisons. This facility is just the latest example of CDCR's readiness to assume responsibility for the mental health care of inmates, and it is a clear testament of our commitment to do so. This 44,000 square foot building cost $24 million. The state has now spent more than $90 million at this institution alone to upgrade mental health services. Not only do we have additional space to treat inmates here, but that creates a ripple effect. We can move inmates from other facilities who are in need of mental health care to this facility. That then frees up space at those other facilities. These kinds of enhancements that you see here today are already online in some of our other facilities, and additional projects are now in the works and near completion at places like Stockton. Once complete, CDCR will have a surplus capacity to provide both the mental health and health care services for the inmate population. Due to these vast improvements, along with the significant reductions in the state prison inmate population, it's time for the federal courts to recognize that we are providing a constitutional level of care to inmates and that we can continue to do so and further improve that care without further monitoring and oversight. The Supreme Court upheld an order for California to reduce our prison population to 137.5% of original design capacity. But most states and the Federal Bureau of Prisons determine capacity by looking at the original design capacity and then factoring in program and housing additions that have been made over the years. They then come up with what they call a rated capacity. And that makes a whole lot of sense. You have to factor in improvements to facilities over time in order to obtain your true capacity. I believe that if we apply these same standards to CDCR prisons, that if you factor in the significant increases to program and housing space and determine our true rated capacity, that we would fall below the 137.5% of capacity ordered by the courts. I urge the courts to allow us to demonstrate this fact and to give us credit for what we have done. Any further court-ordered reduction in our inmate population would indeed pose a threat to public safety. This facility is just one more concrete example of the vast improvements that we have made to increase our capabilities and our capacity to deliver a constitutional level of health care services to our inmate population. And I want to thank you all for being here today.